I would like to hereby give some clarification points when it comes to the ship Aida that has berthed into port this morning. There seems to be an unnecessary panic among the public right about now, which is understandable, of course, with what is ongoing with the coronavirus being a threat to everyone. But in this case, we have to reassure the public that basically that's not the case with this ship. There is no such thing as the coronavirus on board of the AIDA ship. And from last night, we were contacted around 10 o'clock in the night regarding the ship heading towards the port. And from there on, CPS was alerted and the necessary steps were taken. We had contact with Mr. Gerstenbloed, also with our new on board epidemiologist, Ms. Ava Lisa. And the necessary steps were taken according to the protocol to see what will need to be done in order for us to see that it doesn't form no type of threat to the public of St. Martin. So basically, we had contact with the officials on the ship. We had contact with CPS, had contact with officials from the FCCA, and protocols has been followed, and documents were sent. Medical declaration was also requested from the ship before they reach into port. So on the medical declaration, it was confirmed that basically there is no passengers on the ship with the virus. What it was is basically that they had the flu. They were quarantined as well. They were put on the side, and they wasn't forming a further threat for those on top of the ship already. All other necessary steps were also taken. When the ship reached to the port, CPS was contacted. CPS was there as well. And the port had close relationship constantly with CPS, with Ministry of VSA, keeping us informed on along the way, every step that were being taken in order for protocol to be followed and for nothing to be going not according to the rules, and for us not to miss any loopholes. So I want to assure the public basically right about now that there is no need for panic. There is no such thing as the coronavirus on top of the AIDA ship. It's just 4 passengers at the moment that has a regular flu. They're having some symptoms, basically stomach virus. 2 of them have stomach virus, and 2 of them is minor other things that they have that is related to flu symptoms. So let's reassure the public that there is no reason to go out there in the media stating false information, false rumors. We do understand the concern that there is in the public with a possible threat of leaving a ship come in port that might have coronavirus, or thinking that maybe information is being hidden. But rest assured that a medical declaration was given, and once a medical declaration is given, a medical declaration has to be something that is official. So the medical declaration stated that there is no such thing. We have Ms. Ava Lisa, which is the expert on the field when it comes to viruses, detection, and things like that, disease. And she has been, we have been working closely with her advice on what steps to be taken, together with Mr. Gerstenbloed from Curacao, which is the expert that everybody knows as well. We have been getting his cooperation and his input and advice on top of it, and he has cleared us and reaffirmed that basically there is no such threat going on. We also have Mr. Miguel De Weaver, which from last night was also constantly busy in contact with the ship, together with the entire Ministry of VSA. From last night, we was busy doing the necessary steps in order for us to make the right decision and not to put the public of St. Martin at risk. We have also the port here, Mr. Richardson, that will be going into details about which steps he on his end as Chief Security has taken in order in a collaborative effort as a team for us to take the right decision and for it not to have no further precaution or economical negative consequences as well for the country of St. Martin. So I think each one of them will give their own statement when it comes to their side of expertise. Thank you.
Thank you, Minister Gordon Carty. I would now like to invite Ms. Ava Lisa, Head of Collective Prevention Services, to provide her remarks as well.
Good afternoon, radio listeners and televiewers. Good morning. Sorry, it's been a long morning. But I just wanted to reiterate what the minister has already said. We have been very thorough and very involved in making sure that we've received the proper medical declaration, as the minister alluded to. We follow a strict protocol, so the international health regulations, whereby ships are required to report to us 48 hours and 24 hours before coming into port any signs and symptoms of ill passengers or crew members. And I can reassure you that of the passenger manifest and crew manifest, there was only 4 cases which did not meet the case definition for coronavirus. And as the minister stated, these 4 cases are in isolation and did not disembark. So I think that's important to remember and to take into account. As the minister mentioned, the 2 cases were gastroenteritis, and the other 2 cases presented with signs and symptoms that were not consistent with coronavirus. So I just want to make sure to repeat that the ship and, a lot of the sentiment and a lot of what's been being put in the media right now is saying that, we're welcoming a ship with coronavirus, but that is not warranted and not founded. The crew members and passengers have not been in contact with anyone that's traveled to the affected areas. Excuse me. So we're definitely confident that these cases do not pose a threat to our visitors and our population at large. And I just wanted to take this opportunity to remind listeners and viewers that, while we are in the height of flu season, it's important to remember that if you are ill, to stay home or consult with your physician, your family physician. Remember proper respiratory and cough etiquette, so covering your mouth when you're sneezing or coughing, making sure to, wash your hands constantly, or if you don't have access to sink and water, even using alcohol-based hand rubs is quite effective, and making sure that you disinfect your surfaces, but and just making sure that if you're not well, to stay home. So from CPS perspective, as the minister has mentioned, we've been in touch with our network of health officials and experts in the Dutch Caribbean, and we feel as though, based on the information that was submitted on the health declaration, that the ship poses no threat to our visitors and our population. Thank you.
Thank you, Ms. Lisa. I would now like to invite Mr. Leslie Richardson, Head of Safety and Security at the Port of St. Martin, to provide his remarks.
Good morning, all viewers. I would like to mention, as of Port, we as a Safety and Security Management, what we did actually from yesterday evening, the FCCA reached out to Port St. Martin, asking them they needed a berthing space. What we did, we followed our standard protocol, and by following that, we also reached out to CPS, which also gets the health declaration, and based off of the health declaration, we could have seen that everything was safe, so that's our normal procedures we follow, and the ship actually came into berth. What I'd like to also state is because of all the rumors that was actually in the media. So persons on board, persons actually on the port ran in sort of a panic, and because of that, we actually took our other protocol in place. Where we started going around to taxi drivers, going around to shop owners, and letting them know, listen, we have the health declaration and everything is safe. So I would like to reiterate what Minister Gordon Carty said, and also Mr. De Weaver. Things are safe on the port, and we will always follow our protocol to make sure that everyone is safe on St. Martin.
Thank you, Mr. Richardson. I would now like to invite the Secretary General of the Ministry of Tourism, Economic Affairs, Transport, and Telecommunication, Mr. Miguel De Weaver.
Good morning, all, and thank you very much. I think a number of persons before me have basically presented the facts, and I think we want to reassure the public that we have their best interests at heart. We have done all of the necessary due diligence. We, under normal circumstances, if coronavirus was not in the air, actually things would have transpired, like turn away a ship or allow them to come going through this process. This would have happened without anyone even knowing, because the standard protocol, as everyone has indicated before, is already in place, which means 48 hours, the ship has to inform the country, the port, and the port then informs CPS whether there are any cases of persons sick, like with the stomach virus, which 2 of these of the 4 had. And I think this is a normal flu season as well, that many persons will have the flu. And this is something that would have normally just, I think not even a minister would have been involved in the discussion or the decision whether we would allow the ship to actually to come to berth and allow the passengers to disembark. So this is the same process that they have gone through. I think only because the coronavirus is a worldwide concern. This is why we are doing even more due diligence on this subject matter, so that the public is truly informed as to even these persons were asked whether or not, and they were looked at whether or not they have been in contact, they've traveled to China, been in contact with persons with coronavirus. So all of the necessary due diligence about these specific passengers that are infected, which seems to be 2 with the common flu, fever, and the other 2 with the stomach virus. So these are the real checks that we've done to assess the level of the risk, to determine whether or not this ship should be allowed to berth and disembark their passengers. So I think that was done, and we are here to let the public know that this is standard procedure, and we have followed all of the necessary protocols and everything. And I think the 2 previous islands that they visited, no cases of no situation has occurred. So I think we looked at as well to make sure that before they are allowed to disembark, that we can take that into consideration as well. So from our side, I think we've looked at all aspects, in particular allowing the professionals in the health industry to kind of advise and tell us whether everything they should be allowed to berth and disembark. And once we've got the nod of approval, we think we have done a complete due diligence, in particular considering the issue of the coronavirus circumstances that we're facing worldwide. So we'd like to let the public know that we have done a thorough job, and I think they can rest assured that the risk is extremely low.
Thank you, SG De Weaver, for your remarks. I would now like to re-invite the Minister of Public Health, Social Development, and Labor to give her closing remarks.
What we want to say to the public is rest assured that the government as a whole has the public health of the country at heart, and whatever decision we have to take, it will be to the best interests of the public of St. Martin. So meaning, if there is a threat, might there be a threat in the future, we will take the necessary decision in order to avoid of exposing the public to such. So at this moment, that will be the same case. The ship was given authorization to come into port because it didn't form no threat to the public as a whole. So whenever we have to take a decision or make a decision to the best interest of the country St. Martin, it will be done with all the experts giving us advice and giving us the necessary steps that needs to be taken. We will take those into account before deciding or taking any decisions that might hurt or compromise the public health as a whole. Thank you. I would like to give the last word to the Prime Minister.
Thank you, Minister Gordon Carty. Thank you to the other panelists here this morning, as well as to those sitting in our little tribune here in our press briefing room. And thanks, of course, to DCOM for being here to be able to disseminate this information as the official communication agency of government. As Prime Minister of the country, I would like to just reassure the people that I am usually only involved when it becomes actually a disaster. I am the head of the disaster committee, the Emergency Operating Center. I always say committee. Center, and I must say, ever since the coronavirus has become an issue worldwide, I have been in close contact with the Minister of VSA, with the different ESF coordinators, especially that of health, public health, TIAT, ESF 6, 7, and you are 10, because these are the direct, the ones that would be in direct contact with all stakeholders related to this, this something that is touching us worldwide. As St. Martin is a small country that has open ports, we have to be, of course, extra careful, not just for St. Martin, but the hub function that St. Martin serves to the rest of the Caribbean makes it extra diligent, that we have to be extra diligent. And I have been assured over the past 2 weeks that Minister Gordon, together with her staff, together with TIAT, together also even involving Mr. Clive Richardson of the Fire Department, who is the administrative head of the EOC, and in keeping me abreast as well. What we felt as, and because DCOM falls within the purview of the Minister of General Affairs, I have also been involved in ensuring that the information, the good information, the factual information gets out there. It is very irresponsible of persons understanding the repercussions to this country to be out there spreading false rumors. Yesterday, we saw a similar situation in Anguilla, and people must understand that this has a detrimental effect on the income which we all rely on. We will not put the country at risk for money. This is definitely not the case. From the update that I received up to just before this press conference was that initially when the ship was turned away from St. Lucia, there were many more persons on board that were sick, and therefore St. Lucia didn't feel able to handle it had it become more severe. These persons would have remained on board anyway, but of course, ships have a limited amount that they can handle. Even at that time, it was never indicated that it was the coronavirus. As was mentioned before by all and by the health professionals, this is the flu season. From November to February, we always see an increase in reports of upper respiratory illnesses. It's also our high season. So sowieso, as they say in Dutch, with every visitor that comes with a cough, they are bringing, the cold, the germs, back to St. Martin. As a St. Martin people, we know how to stay healthy. Make sure you drink your bush. Make sure you use your ginger, your honey, your lime, add your cinnamon. These are the natural things that you have to do on a daily basis to block these type of viruses. There is nothing that the healthcare professionals are doing other than telling you to stay at home if you do have a virus, any type of respiratory virus, that you wash your hands often, cough in the proper manner, meaning in your elbow, or I have told the little children who don't get their elbow up, cough into your shirt, wear a shawl or whatever the case may be. And if you are really, really sick, to protect your family members, you should wear a mask. I think if we continue to exercise proper coughing and sneezing etiquette, even the virus that is now quite rampant on St. Martin, which is not corona, but just the flu virus that I've seen knock down entire families for up to a week, I am really encouraging the St. Martin people to be vigilant, to stay indoors, to wash hands often, and to really teach the children also the proper coughing etiquette and sneezing. If your children are sick with this virus, please keep them at home, because then you are causing it to have a ripple effect in the schools as well. So I would like to continue to encourage the people of St. Martin to be responsible citizens. When you share news that is fake news, it takes a lot more time to undo all that damage. So go to the official website for St. Martin, stmartingov.org, spelled SINTMAARTENGOV.org. Also, the Government of St. Martin official Facebook page will continue to promote these etiquettes. I've just spoken to Ms. Roach and the, what do you call that person that manages?
Webmaster.
The webmaster for government will ensure that it comes out on a regular basis. So if you're unsure, look for that information in the right place. When people come to you with this type of news, before you share it, look up the correct news, the updated news. We're getting updated news from the World Health Organization, from PAHO on a regular basis, and when things change, if they change, you will be informed. We do not want a panicked nation. An informed nation will make good decisions, and we will be able to protect ourselves as much as possible. The risk, of course, for the whole world is there. We just have to be vigilant and ensure that we have things ready to go if and when something does happen. Also, SXM Gov Radio 107.9 will continue to play broadcasts such as these on a regular basis to update the public. So with that, my presence here today is merely in a supporting role, understanding that as Minister of General Affairs and Prime Minister, I have a responsibility to ensure that the people of St. Martin remain calm, that we take in information and judge the source as it is. I also saw a video of some passengers arriving at PGIA with masks on. Based on my discussion just a few minutes ago with the TIAT SG, it is clear that certain persons have been discriminated against, especially of Asian persuasion. They figure everybody is coming from China. And so to ensure that people don't think they're bringing something with them, they are keeping their quote-unquote germs to themselves. They have chosen to wear masks. And if you know anything about the Asian people in China, in Tokyo, in those places, there's heavy smog, and they use masks as a means of protecting themselves on a regular basis, even before coronavirus became a thing. So this strain of coronavirus, because it has existed for many, many years before. Again, reassuring you, protect yourself at all times. If you're sick, remain indoors, wash hands, use a proper etiquette for sneezing and coughing. And this way, make sure you have paracetamol, because that's all the doctors are prescribing. If you are, however, suffering with upper respiratory illness on a regular basis, so you're an asthma patient, then yes, you are more susceptible and you should go and visit a doctor before it becomes too bad. But for the most part, the flu that's going around now, it's the usual fluids, and take good care of yourself. And by that, I hope that the public has been properly assured that St. Martin has its reactive and proactive measures in place to ensure public health and safety is number one.
Thank you, Prime Minister. Honorable Ministers, Secretary Generals, Department Heads, invited guests, radio listeners, and online viewers, this brings us to the end of this broadcast. On behalf of the Department of Communication, I'm Rolika Roach, and bidding you a pleasant day further.